This is video 2 on polymyalgia rheumatica. So basically, we're going to talk about how it presents, how it's diagnosed, and how it's treated with allopathic Western medicine. We're going to talk about the prognosis. We are going to talk about alternative medical treatments with MDs and what they do as well. Video 3 is going to talk about alternative treatments and alternative ways, basically not just alternative, but deeper ways of what's really causing polymyalgia rheumatica and how to eradicate polymyalgia rheumatica and prevent it from coming back to the point to where you don't need treatment anymore. Polymyalgia rheumatica is an autoimmune disease that presents with pain. It generally presents with pain in the shoulders and in the neck, in the back of the head, and it usually descends through the body over time, down the back, down the flanks, down the arms, into the wrists, into the hands, through the hips, through the legs, into the ankles, and into the feet. A lot of times with progressed polymyalgia rheumatica, people will get to the point to where they won't feel their hands and they won't feel their feet. And so when they get up to walk, a lot of times their balance will be off and they'll trip and they'll fall. When they go to grab things, when they go to grab a cup of water or something, they'll pick it up and they can't feel the cup in their hand and they'll drop the cup. And not only will they not have sensation in their hands and in their feet, but their hands and their feet will be in a lot of pain. So polymyalgia rheumatica is basically a diagnosis based on pain, and it's also a diagnosis that has laboratory markers that show elevated levels of inflammation, such as elevated levels of ESR, otherwise known as SED rate, and or CRP, which is cardiovascular inflammation. So we know there's inflammation of the body. We know there's cardiovascular inflammation, elevated levels of ESR, and inflammation can cause pain. So when we have elevated markers of ESR, CRP without elevated levels of rheumatoid antibodies, we don't necessarily have rheumatoid arthritis, but we have an autoimmune diagnosis of polymyalgia rheumatica because polymyalgia rheumatica begins in the shoulders, generally speaking, and descends throughout the body with pain. The Western medical protocol for treatment is immunosuppressants, corticosteroids, things like prednisone. That's the treatment. So corticosteroids, immunosuppressants, things like prednisone, they suppress the immune system. They suppress the immune response to whatever the immune system is responding to in the body. So instead of helping the immune system, going after whatever it's going after, doctors are suppressing the immune system with immunosuppressive medications. And when you suppress the immune system, you're suppressing things such as the release of histamine and inflammation. Naturopathic doctors, they may take it a little bit of a step further, and they won't necessarily go after the cause of disease either, a lot of times, but instead they will utilize supplements and medications to help suppress the immune system also and or to help break down histamine. What happens with polymyalgia rheumatica is the immune system is releasing an excessive amount of histamine, and histamine causes things like chronic sinusitis and inflammation, brain fog, short-term memory loss, and the inability to sleep. And so what naturopathic doctors will do is instead of going after the cause, they will just break down histamine faster in the body. And one way to break down histamine is to increase the levels of DAO in the body, diamine oxidase. And by increasing levels of DAO in the body, basically what they're doing is they're giving people supplements of DAO. They're giving people diamine oxidase, which is basically porcine kidney. By taking that, people might feel a little bit better, and they might feel quite a bit better for a little while, and then it will start to wear off. And the reason why the effects of Tao will start to wear off is because you get to the point to where you can't take enough Tao. The immune system is causing so much histamine that you can't get it under control. And the other reason is because it's not only histamine causing symptoms. And we'll get into that with video 3. Tau deficiency is not the cause of autoimmune disease. It's not the cause of elevated histamine levels, but it's what naturopathic doctors utilize to help break down elevated levels of histamine. And like I said, it may work a little bit and for a little bit of a time, and it may work a lot for a little bit of a time, but it's not a method of treatment that can be used for long term. The prognosis for the Western medical route of treatment is gradual decline. Less of a rapid decline with immunosuppressants on board. People can take immunosuppressants for decades, but their quality of life is not going to be very good. The cause of what's causing the immune system to fire consistently in the first place is still there in the body, and it's proliferating and it's getting bigger, and it's going to start causing problems in different areas of the body. It may cause issues with the nervous system. It may cause issues with the cardiovascular system. It may cause issues with the digestive system, the urinary system, the pulmonary system. You're going to have dysfunction of the automatic operations of the body, such as your heart, your lungs. So you might present with things like intermittent episodes of tachycardia or POTS, postural orthostatic tachycardia syndrome. Or you might present with shortness of breath or air hunger or asthma. You might present with brain fog, short-term memory loss, bipolar-like symptoms, schizophrenia-like symptoms, inflammation of the brain. You might have inflammation of the nervous system. When you have inflammation of the nerves, you might have loss of sensation and loss of function. When you have inflammation of the bowel, you might have constipation. When you have inflammation of the ureter or the urinary system, you might have a decreased flow of urination to the point to where you might need a catheter at some point. Your vision, people's vision can go bad. They can develop ear problems. They can develop inability to swallow, things like this. So polymyalgia rheumatica can progress to symptoms associated with and even diagnoses associated with things like Parkinson's, MS, dementia, Alzheimer's, things like this. So that's the prognosis of polymyalgia rheumatica, going the route of the Western medical route. People's health and their quality of life is not going to be good. And they're going to continue to need medications if they continue to go this route. And they will probably continue to need other medications for other systems of the body as time goes by. And they will probably need procedures, surgeries, and things like this as more degeneration begins to happen until they might have an event that hospitalizes them once or multiple times, and or they may have an event that kills them. That's the presentation of polymyalgia rheumatica, as well as the diagnosis, as well as the method of treatment, as well as the prognosis. Stick around for video 3, and we will get to the bottom of polymyalgia rheumatica and how to ameliorate symptoms quite well, how to get people symptom free, and then how to help people get their life back to the point to where they don't need to treat themselves anymore, and how to prevent it from coming back. All right. Hope everyone has a good day, and God bless. Take good care.